So I've been in the dental sector for around 10 years now. I specialized originally in health and safety, doing risk assessments. So been around the country, undertaken over 300 risk assessments at dental practices, including health and safety, fire, disability. So this is pretty much a strong topic of mine. Very, very passionate about risk assessing, and probably the best person to be able to talk to you about this today. So what we're going to cover through as part of this webinar is the principles of how to undertake a risk assessment. We're going to have a look at some inspectors to understand what they look at when they come in and inspect your practices. And as Alex touched on, risk assessing is a key piece of evidence that they will look for as part of their inspections at your practices. So they do look at risk assessments. We will look at some of their comments to highlight to you guys what sort of concerns they have when they look at these. And as you can see on your screen now, we will look at how to undertake a risk assessment, how to use pre-populated templates. So I'll be using our templates if you're a member of iComply or iManage. But obviously, if you're not a member of iManage and you get your risk assessment templates from another provider, it will still be the same principles. We'll look about how to use those sort of templates. So to crack on with this, we'll start going through. Now, obviously, the first thing we need to be aware of is our legal obligations. So whilst each region in the UK has their own specific set of regulations, here you can see the Health and Social Care Act in England, and in Wales, you've got the Health and Care Quality Standards. Both of those govern the need to risk assess your business, ensure the risks are being managed appropriately. But the fundamental standard here that applies to everyone, no matter where you are in the UK, is the Management of Health and Safety Work Regs. 1999 covers England, Wales and Scotland. The 2000 covers Northern Ireland, but they both mirror each other in what the expectations are. So they put the fundamental duty of care on us as employers to ensure that we manage and risk assess our business. Okay, so if you're not doing this properly, it will be that regulation that you could find yourself in trouble under. So competence, Alex touched on this. This is a big thing, competence. So what exactly does that mean? Again, under the health and safety work regulations, it does state that you should appoint someone competent within your business to carry out particular tasks. In this case, someone competent to carry out a risk assessment. So competence is defined as someone with the relevant skills, knowledge, technical ability, understanding, communication, and attitude. So skills is around your training, the training you have to do risk assessments. Have you had any sort of certified training? Have you done online training? Have you been able to train yourself around this? But what is your level of skill knowledge around doing risk assessments? Do you understand them? Do you understand how to write them, how to communicate them, and what you need to put into one to make it sufficient? You need to have sufficient knowledge as well. So knowledge is the subject matter that you're assessing. So again, like I've been doing risk assessments in the dental sector for over 10 years. I wouldn't be able to go in and do a risk assessment in the construction site because I don't have the knowledge that's relevant to that industry sector. So again, you need to know what it is you're assessing. You need to have good technical ability. And what that means is you need to be able to understand all the technical guidance around that subject matter that you're assessing. So that could be a particular regulation, that could be British standards, that could be HTM 0105 or 0701. There's lots of HTMs, but you need to understand the relevant technical documents out there that apply to your particular subject matter that you're assessing. So you need to understand all that to apply that knowledge and put it into your assessment. You then need to be able to understand that information. So what that means is you need to be able to interpret it. Can you digest those pieces of guidance or the regulations to be able to communicate that in your assessment? Now, we know that law is written in quite a difficult language. It makes it a little bit confusing at times to fully digest what you need to do. So that's where your understanding of it comes into play. Your communication is about speaking to people involved in that subject matter that you're assessing. Okay, because there's not just your knowledge that needs to apply to it, it's other people's as well. So are you a good communicator? Can you go and ask the right questions for someone who's working on a particular piece of equipment that you're assessing to understand how they interact with that equipment to then enable you to put in play the necessary control measures or requirements around assessing it. And the big one here is attitude. You need to have a good perception of risk. So everyone's perception differs. Some people will look at something and think that that's not very hazardous. Someone else will look at it and think that's extremely hazardous. So you've got to have a good judgment on what risk is. And you need to have a positive approach to this as well. So I know risk assessments is probably a term that we're familiar with. It probably grates on us a little bit because we're made to do these assessments for a lot of things. But you've got to keep positive when you do them, because if you have a negative attitude when you go into risk assessment, the outcome of that won't be sufficient and it won't be suitable for its intended purpose. So competence is defined around those topics, and you will be judged as an assessor on those things. So from an inspector's point of view, these are two comments. I could have picked out a lot. So as Alex touched on again, behind the scenes, we do trend analysis. We look at 10 reports across the regions that have been undertaken by the inspectors. And we use that exercise to identify what sort of concerns are being raised by them, what they're looking at, what they expect from us as providers, to enable us as a company to enhance our products and our policies and documents around those outcomes, but also to identify what the problems are from a practice point of view. So it helps us pinpoint where we can support you guys. Now, these are two comments specifically, and these are recent comments as well on competence. So I'll just leave you to read those for a minute if you haven't already, but you can see here that the inspectors will judge the person that's done those assessments. So they won't just take it as a paper-based exercise. If those assessments have been done in-house, they will question that person who's done them on those pieces of evidence that I showed you on the previous slide. So they will question around their knowledge, around their skills, around their technical ability. And they will then, as inspectors, make a judgment call on whether or not they feel you as the assessor is competent enough to have done that task. If they don't feel that you're competent, that does get flagged in the reports. And we are seeing that a lot at the moment. So it seems like they're putting a bit more focus on this topic. So the principles of risk assessment. So risk assessing is a logical process of examining your work environment that could cause harm or ill health. So you could do a general risk assessment, which covers all the hazards in your practice, or what we're familiar with is doing individual risk assessments on certain topics. So you could do a SHARPS assessment, a lone working assessment. There's no harm in incorporating all those hazards into your general health and safety assessment, but some people do them in different ways. They'll do them individually, or they will do them separately. There's no right or wrong with that, as long as you are covering the hazards and putting in place the necessary controls. But it's about looking at your entire environment to determine what could hurt someone. So to carry out an efficient assessment, there are 5 key components. You first need to identify the hazards. Once you've done that, you need to assess the risk associated with those hazards. You need to control the risk, record the findings, and then review those controls to make sure that they remain relevant. So we'll go through each one of those steps now. So the first one is about identifying the hazards in your premise. So this is something, again, that could cause harm or ill health to anyone. That could be an employee, a contractor, a patient, a visitor, anyone that's coming into your premise that could be affected by a hazard need to be considered as part of the assessment process. So they could be associated with equipment or a combination of both. They can also be categorized into 5 different classifications hazards. So I want to go through each one of those just to broaden your understanding horizons of what hazards could be. So the first one we have is physical hazards. This is anything that can harm the body with or without necessarily touching it. So what I mean by that is if you look at examples of fire, electricity, and radiation, if you put your hand into a fire, you're going to get burned. However, fire, if it's hot enough, can jump. And if you're wearing like hairspray or flammable clothing or anything like that, it can jump and set things alight. Without physically touching it, you could still be at risk. Exactly the same with electricity. If you put your finger into a plug socket, onto an live electrical mains, you're going to get an electric shock. But again, as we know, electricity can jump. So again, if you're close to a live electrical source, there is potential that can jump from that source onto you, and you can still suffer electric shock. Exactly the same with radiation. You point a radiation beam at someone, you're exposed to that radiation risk. But again, we have scatter around radiation that we can't necessarily see, that we need to be aware of. So again, just to define, it's anything that you can touch, anything that can harm you through physical touch or without necessarily touching it. So the other examples there are physical hazards at heights and slips and trips. The second one we got are ergonomic hazards. So this is interaction with the environment or objects that may cause discomfort or pain. So manual handling is an ergonomic hazard. Working with display screen equipment, that is an ergonomic hazard. Working with vibration, noise, and obviously the big one in dentistry is the awkward postures that you can adopt as well when you're treating patients. A lot of bending, twisting, changing positions, all that can lead to poor posture, and that would be classified as an ergonomic hazard. So now we have biological hazards. So bacteria, viruses that pose a threat to the health of a person. So HIV, hepatitis B, big things that we have to be aware of in dentistry. Coronavirus was the new thing that we had to get accustomed to and is now part of our daily lives. Legionella is a biological hazard that is very prominent or can be prominent within the dental sector, and mold and fungi as well. So obviously, if you've got poor ventilation in your building and you've got black mold spores on your ceiling and roof, that is a biological hazard that we need to be aware of. Chemical hazards is the next. So these are substances that can cause changes to human cells. They're called mutagens. Cleaning agents, anything labeled with a hazard warning is a chemical hazard. So is dust, vapor, smoke, and asbestos. So all different types of chemical hazards that we need to be aware of. And then lastly, we have psychological hazards. So these are occupational factors that are harmful to the mental health and well-being of the person. So stress, fatigue, bullying, harassment, burnout, all these sort of psychological hazards that could affect a person's morale, affect a person's ability to work to the best of the ability, and also just depression, anxiety, it can all lead to those sort of health factors as well. So these are all the different types of hazards. Now, the reason I'm explaining this to you guys is if you're doing your own assessment in practice, you need to start thinking a little bit broader than the obvious physical things that you can see. If someone leaves, say, Stanley knife out on the side, that's a very obvious hazard. These ones are hazards that people don't always think about when they're assessing their property, but need to be considered as part of their risk assessment process. So the second step then is, once you've identified the hazards in your premise, you need to then assess the risk associated with those hazards. And to assess the risk, you need to use, well, the best way to assess the risk is to use something called the risk matrix. And the risk matrix is looking at the hazard, deciding the likelihood that that hazard could cause ill health or injury, and then looking at the severity of that injury. And by timesing the likelihood and the severity together will give you the overall risk, which is called the risk rating. So the higher the number for the risk rating, the more problematic that hazard is, and the higher priority it has for you guys to control it. So I'll go into that a little bit more detail later when we look at templates, but this is about assessing the risk. So you need to look at who could be harmed. If it is, I'll go back, a Stanley knife has been left by a builder on the windowsill, and that windowsill is in your patient waiting room, then who could be harmed is your patients, especially then you look at vulnerable patients, children in particular, that could reach out and grab it. So look at the likelihood, who could be harmed based on the hazards that you've identified. Then, as I touched on, consider the severity of that harm. So again, the knife, if a little child goes and grabs that knife, that could be a very, very serious injury to them. You then consider the likelihood of that occurring. So again, if the knife is in the waiting area, the likelihood is going to be increased because of the amount of people in that area. Whereas if the knife was left in a secluded area, such as your attic space or a cellar that's not oftenly accessed, then the likelihood is going to be lower, although you still need to deal with it. And then you need to look at your control measures. So what are you doing at the moment to manage those risks and manage those hazards? And are those controls suitable, or do you need to do something a little bit more? So again, I'll go on to all these a little bit more detail further on, but that's just an overview of how to assess the risk. Once you've done that, then you need to control the risk. So once you've identified who's at risk, you've identified the hazard, who's at risk from it, the severity of that, and what controls you've got in place, you've got to then consider something called the hierarchy of control. Is there anything more you can do to control that particular hazard? Reduce the risk as far as you can. And the hierarchy of control puts an onus on us to consider these steps that you can see in the order that you can see them from left to right. So something I've always been taught, going back to when I was very first qualified as a risk assessor, they taught me around the principle, or using the acronym ERIC prevents death, to remember this. So the first thing you need to do is look at eliminate, and that's your E. So can you eliminate the hazard? So in the case of the Stanley knife, yes, you can. You just take it out of that environment and put it where it belongs, put it out of the way so no one can reach in a secure area. So you eliminate it. That's the first thing you need to consider with any hazard you identify. But obviously that's not always going to be practicable. So if you can't eliminate the hazard, the next thing you need to think about then is, can you reduce the severity of that hazard? So radiation is a good example for this. We can't eliminate radiation because we need it to operate in a dental practice. But for example, by putting a rectangular collimator onto the head of the X-ray unit, the intraoral X-ray unit, means that we're reducing the amount of exposure that the patient is being subjected to. So we can't eliminate it, but we can certainly reduce it. Same example using paints. If you've got a toxic paint, but you need that paint, replace it with a less toxic version. So you're reducing the severity of that particular hazard. If you can't do that, you then think about isolating. So can you isolate people from coming into contact with that hazard? Can you put barriers up to prevent them to preventing contact? So again, COVID was a good example of that, with all your screens that you put up in the reception area when you went back to work. That was a control measure. That was isolating the patients from the receptionists, putting the screen in between them to prevent contact. If you can't do that, control. What controls can you put in place? So this is about your policies and procedures and the systems that you have to manage those hazards. Then you have PPE. So is there any particular PPE you can use or need to put in place to again, prevent contact from people coming into direct contact with it? So your gloves, your masks, your visors. And then lastly, discipline. So this is all around training, monitoring your staff, ensuring that they're being supervised, that they understand what you've put in place and they understand the control measures. So discipline is the last thing that you need to look at. So ERIC prevents death, the hierarchy of control. Consider each one of these in the order to manage your hazards. So again, I'm going to use the example that I touched on, radiation, just to put this into a bit more perspective. This is a hazard within healthcare and we need to control it. So using the acronym ERIC prevents death, can we eliminate it? No, we can't. Exposures are critical for effective dental care, so we need to keep those in place. Can we reduce it? Yes, we can. As I've already touched on, we've got the rectangular collimators, but we can also reduce it by ensuring that exposures are being medically justified. And inspectors will look at this. So this is all part of the reduction. We should only be exposing patients to radiation if there is a medical need. Can we isolate? Yes, we can. We can isolate by incorporating shielding. So we can put up lead line walls in our surgeries if we got particularly small surgeries. Well, that's not to say you go out there and start lead lining all your surgeries. Consult with your RPA first. They will tell you whether or not your particular surgery environment needs any specific shielding requirements, because not all do. But if necessary, that is an option. Can we control it? Yes, we can. We control it by putting in measures and systems to help maintain safe distances. That's your local rules, for example. standing at least 1.5 to 2 meters away from the source of the X-ray and ensuring people are aware of that. Standing outside the surgery when you take exposures, but so these are all sort of control measures. PPE is next. There are PPE available, lead aprons and dose meters. But again, these would only be required where you're doing elevated levels of exposures in your practice. And if you're not quite sure whether you need PPE for your particular operating parameters, speak to your appointed radiation protection advisors and they will tell you. Because to be honest, lead aprons are not generally required anymore in a dental practice. But your RPA will tell you whether or not you need one. And then lastly, discipline. So again, as I mentioned, train your staff on those local rules. Ensure they're aware of the contingency arrangements. They know where to stand when they're taking exposures and what they need to do to protect themselves. And ensure they're up to date with their IRMA CPD qualifications as well. So that's all part of discipline. So that's how you adopt the ERIC Prevents Death acronym and the hierarchy of control using radiation as a good example, looking at each step in order for every hazard that you have identified to come up with the measures that you need to put in place. So once you've done that, you then need to record your findings. So everything you've done, you've identified the hazards, you've looked at your existing controls, you've considered the hierarchy of control to see if there's anything more you can do. You then need to document all of that down. And that needs to be recorded for evidence that you have managed the risk to satisfy your obligation, as we touched on at the start of this webinar. So you need to explain the description of the particular hazard that you've assessed. Again, you need to describe who could be harmed by the hazard. So what, through your analysis, have you identified? So as I mentioned with the knife, that would be particularly children at very high at risk in this situation if it was left in a waiting area, for example. You then need to document what it is you're doing at the moment. So what controls have you got in place right now at the point that you're doing that assessment? So they're not future controls. They need to reflect what you're doing at that precise time. Then you need to look at if there's anything further that you need to do that you're not currently doing. So any gaps. So that's where that hierarchy of control comes into place. So if you identify, oh, I haven't got lead lining, but I need it, or I haven't got my local rules up, and they're part of the controls and the discipline, I need to do that. And you need to document all those further controls as action points. And then ideally what you need to do then is prioritize those actions. Because again, depending on the hierarchy of control will depend on the priority of the actions. You don't put PPE in first if you can do something higher up that hierarchy. So if you can reduce the severity, or if you can isolate the hazard, those are the first things you do. You don't work backwards and put discipline in place first or PPE in place. You always start at the front end of that hierarchy. So the priority action plan should map that out in order of priority using a RAG-rated system, red, amber, green, for example. So once you've done that, you've documented everything down, you put it into your assessment template, you then need to continually review the controls. So assessments need to be reviewed annually at the least, or earlier if you suspect that it is no longer valid. So for example, you need to review your assessment following an accident or an incident. So if someone has had an accident in your practice, look at that control measure, following the investigation of the accident, have a look at the risk assessment that you've undertaken, determine if anything failed, if there's anything you missed. You may then have to update your assessment because you've identified following the accident that you haven't done something that you probably could have done. So review your assessments at that point. Review your assessments as well if you change the layout to your building or introduce new equipment. So, for example, if you decide to start providing aesthetic treatments in your practice, you introduce lasers, never had lasers before, you put them in place, that's a brand new hazard. So therefore, you need to review your assessment and put that new hazard into your template and then look at the controls you need to manage the risks associated with it. So as soon as those changes happen, it's the same with the building. If you go through a major refurbishment, you build an extension, change the layout to introduce a new surgery into your premise, you need to review your assessment to ensure that it covers any potential hazards that have been introduced as part of those changes. You should also review your assessment if there's any major changes in personnel. So this isn't just if you replace a receptionist from a receptionist, you don't have to redo that assessment. But if you introduce a brand new role, for example, like a dedicated decontamination nurse, that's changed the way you're operating things in your practice. You need to look at your assessment to make sure that it accounts for those changes. If there are changes in legislation, that's a pretty obvious one. But if the law changes, then you need to review your assessment to make sure that it still complies with that law and any particular changes within it. As a result of audit of inspection, so this goes back to CQC, HIW, HIS, CPI in Scotland, and RQIA. If they come into your practice, have a look at your assessments, determine that your assessments are not good enough, or they find errors or gaps in it, you then need to review it and improve it to make sure that it covers their concerns. And then finally, through the development of better controls. So technology is advancing all the time. New products are coming out to protect us. So we need to be aware of all these new enhancements and ensure that our assessments reflect those. So if something does come out that can better control a hazard that we haven't already got in place, Safer Sharps is a good example of this. Before they existed, the risk assessments were just around how you manage your sharp instruments. Then Safer Sharps came out. Now the risk assessments need to consider the use of them instead. So every time there's an enhancement or something new, look at your assessment, consider whether there's more or better things you can put in place. So always keep your assessment live. It's not just a paper exercise that you complete, file away and leave it on the shelf to gather dust. Always look at it, always keep it relevant. So now we're going to go into detail of how to use these templates and touch a little bit more on what I've covered. So regardless of whether you're an iComply member or whether you're using templates provided by another company or even downloading templates that you found on the internet, you still have responsibilities of how you manage those templates. So in iComply, we've got lots of examples that you can see on the screen. Our assessments cover autoclaves, compressors known as pressure vessels. We've got individual assessments for pregnant colleagues, radiation, Hep B, DBS, lots and lots of things. But essentially, all those hazards that I touched on earlier in this webinar, the different types, whether it's physical, ergonomic, psychological, you need to be considering all of those through your templates. You can cover the majority of those off as a general health and safety risk assessment, or you can do individual ones. The choice is yours, and different providers will give you different options of how you manage them. So our general health and safety risk assessment, M250B, covers a lot of those hazards that I've discussed. But then in addition to that, we have got individual ones as well. So it does depend, mix and match. Different providers will give you different ways of doing it. When you do use a pre-populated template, it is very, very, very important. I can't stress enough how important that you review that template and bespoke it to your practice. As a provider of templates, it's important to understand that we as the provider, whether that's us or another company, we haven't necessarily been to your practice. We haven't necessarily seen your layout, how you operate, how you do things. So everything that are put onto those templates is guidance. It's for you to look and then adapt to your specific working practices and your building layout. So don't take them as face value and go, oh yeah, we're doing all of that, it's fine, I'll leave them in. Make sure you look at them, make sure you scrutinize them, and make sure you adapt them. This is very important from an inspection point of view, because this is what inspectors will look at. They will ask to see your fire risk assessment, for example. You give them your template, and then what they will do is they will cross-reference that template with your practice. They will look at all your control measures. They will look around the building then to determine whether or not those controls are actually in place. And we have seen through our trend analysis a lot of comments from inspectors saying, oh, well, we saw this, but it wasn't detailed on the assessment, or even vice versa. This was detailed on the assessment, but they haven't got this in place. So it shows to them that it hasn't been done properly, competently, or accurately. So please ensure that you tailor your assessment. So you need to look at the hazards that have been listed on your templates, because not all hazards will be applicable to you. I've touched on lasers. So if you've got a pre-populated template that has lasers in there as a predetermined hazard, and you don't have lasers in your practice, delete that entire row from it. Don't leave it in there. Delete it. Get rid of it. It's not relevant to you. So check all the hazards and delete the ones that don't correspond. Again, check the who is at risk. So make sure that the people that are listed on these templates reflect the people in your practice, and include any people that may not be on it that you feel need to be added or that could be exposed to that particular hazard. So update that section as well. And then, as I've touched on in detail, please check the control measures that are listed on these templates, because not all the control measures will be in place at your practice. You may have some of them, you may have all of them, but there may be also things that you're doing in the practice that are not on these checklists. And that's why you need to add additional things to it. So don't take this as the full exhaustive list of controls. There may be extra things that you are doing that you should then be recording on here. So check your assessment, check the content of it, and update it to reflect your working practices. So once you've done that, then you then need to start assessing the risk. So this is where I'm going to go into a little bit more detail on what I touched on earlier. So you need to look at each hazard that's identified on your templates. You then need to come to that risk rating score, and that's the likelihood times the severity. So the first thing you need to look at is the likelihood. What is the likelihood of someone being injured by that particular hazard? So in the example on your screen, we're looking at electricity. So to judge the likelihood score, you need to look at all the controls that you've got in place right now at the point you're doing the assessment to determine, are those controls suitable and sufficient? So as an example, if you haven't done your 5-yearly electrical installation condition report, or fixed wire testing as it's referred to sometimes, that is a big control measure. That tests your internal electrical supply to make sure it's safe. So every time that someone plugs something into a power outlet, they're not going to be exposed to a faulty electrical mains. So if you haven't done that, that's a critical control measure that's missing. So the likelihood, if that's missing, would increase. And depending on the last time it was done, if you've never ever done an electrical installation condition report, I would be putting the likelihood is a 3. It's likely that someone is going to get injured when they plug something out of mains, because you have no verification of the state of repair of it or whether or not it poses a risk. So this is all determined around the control measures you have. Anything that's missing will make the likelihood increase. The more that's missing, it will increase further. The less that's missing, it will decrease. But also, if you're missing key control measures, that may bump it up from a 1 to 3. So look at your controls to make that judgment on the likelihood, and then enter your judgment into your assessment. So I'm showing on my assessment here that you can see the process of calculating the score. You don't necessarily need to show that process on your template, but for the purposes of the webinar, it's quite helpful for me to do it. So I've put on here 1 because I've got all the controls that are expected of me in place. So likelihood, in my eyes, doing this assessment, it's unlikely that someone's going to be caught at risk of harm. Once I've done that, then I look at the severity. So again, how you judge this is if something fails. If those control measures fail in any way, if someone doesn't do something, doesn't follow the controls that they're supposed to, that are detailed on here, what is the most probable outcome? So you need to think about the hazard and what is likely to happen if someone does come into contact with that. So in relation to electricity, we are talking about electric shocks. So if one of those control measures fail and someone does come into contact with electricity, they're likely to get an electric shock. Therefore, the severity in this case will be a 3, because electric shocks are quite severe. They can lead to unfortunate death or more serious health issues. So your severity is not necessarily linked to your control measures, it's linked to the hazard. And every hazard will have a different severity of risk. So I've come to the conclusion here that the likelihood is a 1, and the severity, if those controls fail, would be a 3. So I need to times those two scores together to give me my overall risk rating, which in this case would be a 3. So that is the lowest risk rating I can get for this particular hazard. I can't get lower than that because I can't reduce the severity of electricity in the practice because we need it. You can reduce the severity of other hazards. As I mentioned, if you were assessing paints, you could get a less toxic version of that in place. So you can then look at reducing the severity. But in other cases, you won't be able to. Fire, Legionella will all have a high severity because they can all result in potential death if something goes wrong. So people get the severity scoring wrong in a lot of cases. They will put 1 in for an electricity, fire, Legionella when it's not. If you have an electric shock, it's not going to be a minor injury. It's going to be more than that. So think about the most reasonable injury that you could get from that particular hazard when you score the severity. When you've done that, then you've scored all your hazards. That will give you your priority action plan. So the higher the number you've got then on your risk assessment will determine how much priority you need to have on controlling those risks and those hazards. So if you've got anything that's a 6 or a 9, you need to focus on them immediately. So again, what you need to do is if you're missing any controls or if there's things you can put in place to reduce that risk rating lower, you need to put those in as further actions. Don't just put them into expected controls if they're not already in place. Put them into further actions and set yourself an action plan to address those. Again, if you put them into existing control measures, inspectors will look at that and they go, well, you haven't done this yet, so it's not an existing control. So again, it's falsifying the information. Within iComply, we've got the tools to help you with this. So again, it depends on the system that you're using. It depends how you're managing risk assessments, but you need to show to inspectors that you've got that process of managing your risks. So within your cycle as an iComply member, we have scheduled all your reoccurring risks, and they will come up in your calendar throughout the year to tell you when you need to review them, when you need to have a look at them. You will also have access to the templates that we provided, but again, as I've touched on, you still need to review and adopt and bespoke those templates to suit your practice. If you are outsourcing your templates and you've got an external inspector to come in and do them, you can upload those templates to your cycle and put them into the activity. If you have then got an action plan, and this will vary on from practice to practice how you manage assessments and what tools you use, but once you've got that action plan, you then need to delegate it to relevant people. You need to ensure that you follow up on them. So again, within iComply, you can use the create related task function, set those particular actions, delegate them to members of the team, and give yourselves and that member of the team reminders to follow up on it. So it's a very effective system to show to inspectors what you've got in place to manage the outputs of your assessments. So again, inspectors' feedback on risk assessing. So this puts it into a nutshell, everything I've discussed and all the concerns that are raised around competence, around how assessments are managed. This comes direct from the horse's mouth. So all these quotes here are from the last couple of months, CQC, HIW. And you can see here, I'm not going to talk through them one by one, but you can have a look at these, review them, and it will give you a good understanding of how inspectors are judging how risk assessments are being managed in your practice. So the key trend in here is that the assessments are not reflective. They don't show the inspectors, they don't give them confidence that they've been done properly, that they've considered all the risk controls, they're being followed up on. And to be honest, they're just not being done effectively. So it is quite key, this. I could have pulled off a lot more quotes. I didn't want to overburden or scare anyone too much with this. But it is a key thing. Risk assessments is one of the biggest downfalls that we are seeing through our inspection trend analysis for practices. And it does come down to this. So if you want to do your own assessment, please make sure you understand the requirements of that assessment, the topics, the subject matter, and the technical guidance around it to be able to do it properly. If you've got any concerns about doing risk assessments, then we advise, and I would always say, outsource it. I've been doing assessments for over 10 years. I'm qualified. I understand the sector, the business, all the equipment that's used in it. I understand all the technical guidance, the legislation to go with. So I feel confident to do it. But if you've got any doubts, please, I would say outsource it out and get someone in to do it for you. It covers you and it protects you, because if something does go wrong, if someone has been injured at your practice, the onus doesn't fall on your shoulders then as the assessor. Whereas if you've outsourced it, it falls on them. You've got the onus to follow up on those actions, but the actual assessment process, the initial one, can be pushed off to someone else. So don't take that onus on yourselves if you've got any element of doubt about doing one. So we have recently introduced a partnership. So if you're a member of ours, or you may have seen it on our social media accounts, but we have identified this as a bit of a problem area. So in the last couple of months, we have joined forces with a couple of key providers in the UK to help practices with managing risk assessments. We've partnered with Life Environmental Services and Chubb, who can carry out certain risk assessments for you. We've partnered with St. John's Ambulance. Now, if you wanted to do your own assessments in-house, but felt you need a little bit more training, certified training, then St. John's Ambulance do the IOSH Managing Safely course. And that's an ideal course for managers, supervisors, to give them a broader perspective of how to carry out risk assessments. What I've done here as part of this webinar is give you a quick overview, but that course is really, really good. It's the very first course I did when I started off in this career path, IOSH Managing Safely. Then I went on to the NEBOSH courses. But IOSH is a really, really good user-friendly course. So St. John's Ambulance offer that, and that's why we've partnered with them to give our members access to this. And then we've got Hawksworth as well. So again, these are all about doing your electrical testing. So if you have identified a hazard in your practice around electricity, Hawksworth are in place. So these are 4 of the partnerships that we've got in place now to help our members put risk assessments in place properly, effectively, and efficiently. They're competent companies. I've worked with them for the last 10 years throughout the business, throughout my career path, and I've brought them along with me because I have full faith in what they do and how they go about doing stuff. So if you do want external support, we've now got this in place that our members can access. So please take advantage of it. All right, then. Well, thank you. Yeah, no, just looking at your Q&A now. There's a few good questions in here, so I'll go through them, try and get through as many as I can, hopefully all of them. So if you're happy to stay on and listen to the answers, that'd be great, but I will go through them all now and answer. So the first one here, can PM without specific qualifications complete a review of a risk assessment if competent person completed it in the first place, e.g. a 6-monthly review? Yes, you can. So essentially, once the initial assessment has been done and identified all the hazards and put in place your action plan, as long as you understand the information within that assessment, and again, this goes back to your interpretation ability, you can do it. So if you haven't been trained in how to do the initial, you can review the assessment provided you understand the information within it. As soon as something changes, though, so again, going back to if the process changes, introduce a new piece of equipment or anything like that, you are responsible for identifying that then to trigger whether or not a new assessment needs to be undertaken. So you can review it if you know the information, but you need to be able to understand when that assessment may become void and need to be redone. So again, just ask yourself questions around the information within the assessment. Can you read through it all? Have you got any questions? Does anything flag up going on? Don't quite understand what that means. If you can do a bit of research on it to answer those questions yourself, great. If you're a member of iComply, I manage in particular, give us a call and we can help you with it. But yeah, you can. That's fine. Right. So does an external company need to come in and do a risk assessment periodic every 2 years, for example? So no, this all comes back to you need to identify when that assessment is no longer relevant. So companies will generally put a recommended review date on their assessments, but that's a recommendation. Assessments do not expire. And if a company is putting an expiry date on it, they shouldn't be. Assessments last indefinitely until something changes that warrants them to be redone. So they can put recommended review dates, but that is a review date. So at that point, review it. But anyway, you should be reviewing it more than 2 years, every year, or as I discussed earlier in the webinar, when things change.
I've just said we have them in the iComply cycle as an annual review, because it's just check on an annual basis that nothing's changed. It's still fit for purpose, right?
Annual should be the minimum, because a lot of things can change in 12 months. A hell of a lot of things can change in 24 months. So review your assessments annually. And that is just a quick review. Scan through it. Look back at that last 12 months. Has anything changed in the practice? Ask yourself questions. Is it all still relevant? Is it still applicable? And simple things as well, like especially from a Legionella point of view. I've seen this a lot when I've been out visiting practices, but I've seen a historic assessment that was done in like 2020. And that assessment says that the practice had a cold water tank. Yet now they've got a combination boiler, because in 2021 they took out that cold water tank and replaced it with a better hot water service. So again, that assessment is no longer valid, and that hasn't been picked up on. So check them often and keep them relevant. So our Legionella risk assessment is due on iComply now, and it looks like managers and nurses have completed it previously. I did notice it says at the top it should be completed by a qualified or competent person. What should I do if I don't feel competent to carry out a risk assessment like fire, health and safety, or Legionella? Simple, as I said, outsource. If you do not feel confident to do it yourself, outsource it. Life Environmental, one of our partners, they do fire Legionella risk assessments. Chubb do fire risk assessments, one of the others. So outsource, definitely, 100%. Eliminate that uncertainty. Don't put the pressure on your own shoulders, and don't put the responsibility on your own shoulders if you're not happy. And to be honest, there's no point trying to do it and get away with it, because now what we're seeing through the inspection trends, the inspectors are questioning this and will question you as well. So if they got question marks or red flags around your assessment, they will question you as the individual on why you felt you were able to do it. So again, don't put yourself in that position, just outsource. It's only a couple of £100, so it's not a lot out of your pocket. And you know it's been done properly. So is there a time limit for new practice managers to complete review assessments? I recently joined the practice but had no handover from previous manager and getting through compliance day by day, but don't want to miss any deadlines. Right, a bit difficult one, but essentially there is no time limit, but you need to make sure those assessments are relevant and they're accurate and they've been done properly. Now, I would say they should be one of your priority documents that you get up to date. But I appreciate and sympathize that you've got a lot to juggle in a practice. So trying to coordinate your responsibilities can be difficult at times. If you've got an upcoming inspection, risk assessment should be one of the first things you do to get in place to satisfy that inspector. So you have to have a judgment call on that and try and get them in as soon as possible. But definitely, if you've got an upcoming inspection, get them done as a priority piece of evidence.
Rhys, can I add to that one if you don't mind?
Yeah.
I think it's the angles maybe on the wrong. I can completely understand being, having been a PM and sitting from that and sitting in that position where that question's coming from. I think the perspective's slightly off, because it's not about you or you having a time limit. No one's going to come in. No, there's not an expectation for a practice manager to do something particularly often. The bottom line is that the legal situation is at all times the business must have an accurate and up-to-date risk assessment. That's actually we say to review every year, and you probably catch most things. So I guess the thing is just, what is the risk there of how competent or how good do we feel the risk assessment is that's in place now, or do we know if there is a risk assessment in place? And it probably wouldn't sit on the manager necessarily, maybe even sit with the principal, as in if something went wrong in the practice and something went really wrong and someone got really injured and then they sued and you ended up in court, HSE aren't going to mind about when the practice manager started. All they're going to say is you didn't have a risk assessment in place, or your risk assessment wasn't sufficient. Am I right?
Yes. Yes.
Okay. So I think that's more. Don't see it. If I was a manager in that position and you're competent enough to review risk assessment, then have a quick look, see if they're fit for purpose. If they're not, prioritize it.
Okay. So what would be an example of level 5 severity, please? Okay. So this all depends on the template that you're using or who's provided your risk assessments. But essentially, risk matrices come in different shapes and sizes. So as iComply, we use a 3x3 risk matrix to keep it simple. So other companies will use a 5x5, and other companies could use a 9x9. They come in different shapes and sizes, but the bigger the risk matrix, usually the bigger risk matrices come with higher risk industries. So if you're going into construction or power plant, you would use a bigger scoring. But level 5 severity would have the same as a level 3 in our case. That's your highest severity, which is death or serious disability. Serious injury resulting in disability. So level 3, level 5 would be the same. Whatever the highest number is on your particular assessment means that it is the worst possible outcome. Would you recommend outsourcing any particular risk assessments other than 5 Legionella and health and safety? No, in our sector, fire and Legionella are probably the two common downfalls for a practice to do themselves. They have so much you need to have so much technical knowledge to do those assessments. There are so many pieces of guidance around it. As Alex touched on it with thickness of fire doors, you need to know protected escape routes and travel distances and the different fire-resistant properties of different materials. There's so many things you need to know. And then with Legionella, you need to know plumbing schematics. They're very, very technical subjects. So I would say, unless you've got a background in those, outsource them. Other areas, there should be someone in your practice doing it. If you're looking at Sharp's risk assessment, you should be able to do that in practice because you work with Sharps all the time. So all you need to do is upskill your knowledge around the health and safety Sharps regulations to understand from a regulatory point of view what it is you're supposed to be doing. If you're a member of iComply, all of that is presented to you as part of our documentation. So just having a quick scan of it. But no, other assessments, you should be competent enough to do them in-house. But again, it's just about having a look at what the topic matter is and just asking yourself a few questions. Do I understand what this is? Do I know the legislative framework around it? And can I use that information to put together a sufficient assessment? So again, you should be okay to do with it. But again, if you're a member of us, that's where we can help you. So if you're a member of iComply or iManage, give us a call and we can give you some advice and help regarding those.
I think that actually segues in quite nicely. We've got two questions here where someone said, is there such a thing as a consultant to assess the current iComply previous risk assessments? Which I think is a really good question. And someone said, do we come into practice at all to help with risk assessments or advise, or is it all done through iComply? We've got different services and things that we offer. So if you're an iComply subscriber, then you have access to our helpline, which is general compliance advice. They wouldn't review your risk assessments for you, but the team there, Rachel, Olivia, Leonie, are really helpful, and they are IOSH trained. So if you speak to them about risk assessment principles, they can help you on that, but they wouldn't review yours. If you want someone out to your practice who can advise and review, then we do have what's called a health check service, where it's basically a CQC mock inspection, where someone will come to your practice and you pay 749 plus VAT, and they come out for the day and they will go through everything. And as part of that, they will review and have a look at your risk assessments. And then with iManage, slightly differently, we will review your risk assessments. So your risk assessments get feedback from your iManager, who will look for competency issues and will recommend whether they think it would be all right with an inspector or not. So there's different levels of different things that you can have within the business.
Thank you, Alex. Last question, and then I think that's us wrapped up. There's no more I can see. Would completing your online courses, e.g. Legionella, QC be sufficient to be competent to carry out Legionella RA, or do the BDA require formal quality qualifications? So in short, no, they don't require formal qualifications for doing these assessments. They will make their judgment based on what evidence you present on the day of questioning. So if they
do we mean CQC, by the way, not BDA? BDA wouldn't. Yeah, sorry. I just thought it might be worth. I think it would be CQC, maybe not BDA that they mean.
Yeah, fine. But yeah, so CQC then, if it's any inspector, regardless of who, any inspector, whether that's CQC, HSE, NHS, anyone like that questions your competence, you have to convince them. That's what it comes down to. You have to convince them. So if you've got a certified qualification in it, that's easy. You can just present that piece of paper and say, I've been trained to this standard. If you haven't got it, you have to show to them that you know what you're on about. You have to convince them that you can answer questions, that you have the technical ability, and move them over. If you can't do that, then that will raise flags. So that's a bit of a difficult one. And even if you've got a certified training certificate, that still doesn't make you fully competent, because anyone can do a course to get a certificate, but then can you apply that knowledge into your practice? So like, I've got my certification, but I've also got 10 years experience of doing assessments. So I'm very competent in what I know. So it is a difficult one, and it is down to you to convince and justify your competence to whoever is asking you. Okay. I think that's it. How can we be notified of future webinars? So any future webinars are being posted on our social media accounts. So all our webinars are uploaded to our YouTube channel. So you can go on there for historic webinars, and then follow us. Follow us on LinkedIn, follow us on Facebook, follow us on our other social media accounts, and we will always be publicizing when future webinars are coming up. So keep your eyes open. We've got plenty planned for this year, and there'll be more to come. Okay, I think that's it then. I think I've answered everything. So for those of you who are still here, I hope that was beneficial to you, and I will look forward to seeing you again sometime in the future. Ta-ra.
Thanks, everyone. Thanks, Rhys.